received some excellent questions already. If you have additional questions, understand it's not too late to add them to the comments section on Facebook, and we'll get to them as time allows. But before we get started, I'd like to begin by thanking our incredible staff for their dedication and support over the past year. The team and I truly appreciate everything you do for this organization, for our patients, and ultimately our MHS mission.
Hey, thank you, sir, and I couldn't agree more. I totally agree with that. Our personnel across the organization have been doing an amazing job. From our public health and clinical personnel to our logistics team and auxiliary staff, I couldn't be more proud of their continued efforts to help combat this terrible pandemic.
Now, teammates, as you may be aware, we recently moved into Phase 1 Bravo of the MHS vaccine program here at the SAMHS. Phase 1 Bravo includes beneficiaries age 75 and older, personnel who perform critical national capabilities, and those preparing to deploy outside of the United States, and other frontline essential workers. Now, this is the DoD vaccination schema, which is different than what CDC puts out. We follow the DoD regulations. As a SAMHS market, we've decided to divide these efforts. BAMC is currently vaccinating eligible 1 Alpha and 1 Bravo personnel, while Wilford Hall is focusing on vaccinating TRICARE beneficiaries age 75 and older. So 75 and older at Wilford Hall, the other 1 Bravo populations at BAMC. With such a large population of beneficiaries, all COVID vaccine appointments for beneficiaries 75 and older at Wilford Hall were booked very quickly. Now, we're closely tracking vaccine availability, and we'll let you know as soon as more appointments become available. Phase 1 Bravo military and DoD civilian personnel should contact their units to inquire about vaccine availability and scheduling.
Please keep in mind, we face many of the same challenges as our civilian counterparts when it comes to vaccine supply and demand, and continue to do our best to ensure the most effective use of our vaccine allocations. These allocations are being distributed across the military and around the world, and we're working to use our allotments as soon as they enter our building. We greatly appreciate everyone's patience and support as we continue to coordinate vaccine opportunities based on anticipated shipments.
So we're pleased to announce that we have secured a dedicated vaccination site on Fort Sam Houston proper, and that will enable us to increase our throughput while offering a convenient location and parking for folks needing a vaccination. And we're currently setting up and validating this new location on Fort Sam, and we'll open it for business. And as this site will serve as the sole COVID vaccination location as we continue Phase 1 Bravo operations. In other words, we will not be providing vaccinations en masse inside of BAMC's walls. This new site will enable us to increase the number of vaccinations we're able to administer in a day, and eventually enable us to safely expand first to beneficiaries 75 and older, then next to our next phase, which opens the program to the high-risk beneficiaries such as patients 65 and older, pregnant women, and patients 16 and older with a pre-existing condition. Now, as we expand to additional populations, we'll post the information online, on social media, and through secure messaging, and we'll provide details on how high-risk beneficiaries can inquire about their eligibility to receive a vaccine and the process for administration.
The COVID vaccine is voluntary under the FDA's emergency use authorization, but highly encouraged. If you're undecided, the best thing you can do is arm yourself with information. We want to make sure everyone is equipped with the right information to make a good decision. You can find a wealth of information about the vaccine online, or please feel free to consult with one of our infectious disease experts, such as those on our panel today.
Thanks, Sergeant Major. Now, in other news, this month we recognize Black History Month, a time for us to honor the contributions of African Americans and people of African descent within our military and our nation. African Americans have played a pivotal role in the United States military throughout its history, honorably answering the call to duty and serving with great valor and distinction. As just one example, Dr. Lewis Tompkins Wright, the son of a man born into slavery, graduated from Harvard University School of Medicine in 1915 with high honors. He was commissioned as a first lieutenant in the medical section of the Reserve Corps and rose to the rank of lieutenant colonel during World War I. Among his many pioneering efforts was the introduction of the injection method of the smallpox vaccine, a method adopted by the Army as a medical standard. In 1919, he became the first black physician appointed to the staff of a white hospital in New York.
In celebration of Dr. Wright and so many other important people, past and present, we will host a Facebook Live Black History Month commemoration on 23 February at 1400 hours. The event will feature a panel discussion on significant historic and current events. This is time for us to come together and celebrate our diversity. We encourage everyone to watch the event on BAMC Facebook page. The BAMC Committee on Diversity, Equity, and Inclusion is also looking for members. Their next meeting is scheduled for 18 February at 1200 hours on MS Teams. Please keep an eye out for an email on how to participate.
Now, before we turn to the questions, we would like to take a moment to introduce our organization's values. Our organization has always had a mission and vision statement, but as leaders, we felt it was important to have organizational values to help inform our words and actions. Our values are integrity, compassion, dignity and respect, and commitment to excellence.
Integrity has two meanings, and both fit within our organizational values. Integrity is about being honest and having strong moral principles. It is also defined as a condition of being unified or sound in construction.
Yeah. Compassion is defined as the concern for the suffering or the misfortune of others, a sympathetic consciousness of others' distress together with a desire to alleviate it. As healthcare professionals, we must exemplify compassion for our patients and for one another.
Dignity and respect. This goes to the core of our military values. Dignity is the quality of being worthy, honored, or esteemed. Respect is a feeling of deep admiration for someone or something. These go hand in hand. We must be dignified and respectful in all we do.
Yeah. And finally, commitment to excellence is a first step to continuous improvement and the driving force behind all top-rated organizations. Excellence does not happen in silos. The entire organization must embrace the continuous improvement approach. We hope that you embrace these values. We know that you already exemplify them in everything that you do each and every day.
Again, we want to thank our staff, our patients, and their family members for their continued support during these trying times. We know there have been many changes and program modifications throughout this pandemic, and appreciate your patience and your understanding.
Yeah. So on behalf of the entire command team, thank you for your continued support, your hard work, and your dedication. You are truly appreciated. Now, without further ado, let's get to the questions, Elaine.
Thank you, sir, and thank you, Command Sergeant Major. I'm Elaine Sanchez, BAMC Public Affairs Officer. Welcome to this month's Facebook Live Town Hall. Thank you to everyone who submitted questions in advance. If you're watching on Facebook, we welcome you to post your questions regarding COVID or any topic during the Town Hall in the comment section, and we will do our absolute best to answer them throughout the Town Hall. The majority of the pre-submitted questions involve safety and efficacy of the vaccine and BAMC's plan for distribution. However, we did receive a few facility-related questions. To start, first question, are the stop signs returning to the parking garage?
I'll take this one. We're in the process of repainting the signs on the ground in reflective red. We removed the majority of the portable signs because drivers were accidentally running into them. This underscores the need to drive safely and slowly throughout the parking areas. Additionally, we would like to remind our staff to park in the garage and to ensure you police your area to avoid leaving trash behind. Our patients and visitors' first impression of our hospital start at the gate, and the parking areas are an extension of our facility. Please also remember the parking areas adjacent to the hospital are designated for patients. Remember our value of dignity and respect.
Thank you. Another question, I believe, for you. In the BAMC gym, the treadmill has not been working for at least a month. How can we get it repaired? Can we order better cardio machines?
Hey, we appreciate you raising this concern and your focus on physical fitness. We have a work order in for the repair of the treadmill, and we're looking at the possibility of new gym equipment. We'll keep everyone posted. As in our parking areas, please make sure you police your area in the gym and wipe down equipment after each use. If we all take care of the equipment, it will last longer and be safer for all.
Thank you. We did receive a Facebook question, but it ties into the next question that was pre-submitted. So the Facebook question was, when will elective surgeries resume? And the question that was pre-submitted, can we please resume bariatric surgeries, even if it's a reduced amount?
All right, I'll take this. So we reduced the number of non-elective, non-urgent and elective surgeries to preserve critical resources and prioritizing trauma and acute care. Now, we understand the concern and inconvenience this decision causes, and we're confident that we'll be able to reopen quickly to elective cases once conditions warrant. Just to put it simply, it is conditions-based. We're in the middle of a pandemic. There's a demand for resources on all sides, and we're doing the best that we can to balance patient safety with the resources that we have. Now, we will continue to assess conditions on a daily basis and adjust as needed. In the meantime, we really appreciate everyone's patience and support as we navigate this COVID environment. Thank you.
Thank you, sir. I just wanted to ask one more Facebook question before we return to the pre-submitted. How do you think COVID will impact summer PCS or permanent change of station season this summer?
Yeah. So right now, we already have travel guidance in place through DOD. I suspect that as we vaccinate folks and as CDC puts out more guidance, then the DOD will give us additional guidance on what are the requirements for testing, potentially for vaccination, potentially for quarantine, both at the gaining and losing installations. If last summer was an indication, we will see probably some delays in travel for some folks. It also depends on what happens overseas. With that said, the military mission will not stop. We are still a force that has to deploy, that has to move. So I don't think it will stop PCS moves, but once we know the requirements, then we can kind of backwards plan and how to resource the increased need for testing and the increased need for quarantine, and we'll coordinate it accordingly. However, I don't see the Army or the Air Force stopping PCS moves because of a pandemic, because we as military still have a mission to accomplish. Do you have anything to add?
So I'll just add, that's a difficult question to answer. The operational environment is going to kind of determine some different variables that will affect individuals' ability to PCS and move from one location to another. And that could change from day to day. So it's truly difficult to answer. I think we will see some effects similar to what we experienced last summer, but we'll continue to move forward and meet mission requirements.
Thank you. Next question. After receiving the vaccine, how can I be sure I will not get sick from it?
I can take this one, sir. Yes, so none of the currently available vaccines or the COVID vaccines in development in the United States contain the live virus that causes COVID-19. So in other words, you can't get sick with COVID-19 from the vaccine itself. Now, the vaccines do teach our immune system how to respond to and fight the virus that causes COVID-19. And oftentimes this process can cause symptoms, short-lived symptoms for a day or two after receiving a dose. These symptoms are normal and are really a sign that the body's building protection against the virus. The most common symptom is pain, redness, and swelling at the injection site, which can last 1 or 2 days. And systemic reactions are also described and fairly frequent, especially after the second dose. These include fever, fatigue, headache, chills, muscle and joint pain. So systemic reactions also usually occur within 2 days of receiving the vaccine and last for a day or two. If you're concerned about your symptoms, don't hesitate to call your clinic where you're enrolled for medical care. Also there are specific instructions listed after you get the vaccine of what to do if you have an unexpected symptom.
Thank you very much, Colonel Yoon. I have been hearing about the variant strains of the coronavirus and wonder how these variants are impacting current vaccination efforts.
Yeah, so there is a lot of concern about variant strains out there with regard to potential increases in transmission risk in particular. At this time, it's unclear how effective the current messenger RNA vaccines are against the new strains that have been described, although early research and early reports are fairly encouraging. It's important to note that new strains emerge because of uncontrolled transmission of virus. So really, the more quickly vaccination efforts can help the population to reach immunity, the less we will have to be concerned about new strains continuing to emerge.
Thank you. I'm going to a Facebook question. Will the tier following 75 and older beneficiaries include all beneficiaries 65 and older, or only those 65 and older with pre-existing conditions?
Yeah, I could take this one. Yeah. Good question. I think there's a lot of questions about when people are going to be eligible, and so what we're doing is the current tier, the 1 Bravo, includes dependents that are 75 and older. When we have enough vaccine to move into the next tier, then we're going to open up to dependents who are 65 and older, as well as those younger who have pre-existing conditions. So all of it is dependent upon when we get vaccine and how much we get between both BAMC and all.
Thank you. With the increased operation tempo here at BAMC and the high census, why is BAMC pulling active duty nurses for taskings in COVID deployments?
Yeah, I'll answer that. So first off, thanks for asking that question, and I appreciate you raising a concern. I understand the stress that this places on the entire team. What you got to understand is that right now, this is being directed by the President of the United States. The federal COVID response team has directed the Secretary of Defense to respond. The Secretary of Defense has deemed vaccination of the population as a priority, which means that the DoD forces are going to get requests for manpower. That request for manpower is not discretionary. As the Commanding General of BAMC, I do not have the ability to say no. What we have to do is say, if you take X number of people, here is the impact to the mission, and here are the mitigation strategies, and it's up to our higher headquarters to say yay or nay. Now, with that said, we're going to be in support. All the services are fully in support of this national effort. It's not just BAMC. Forces are deploying from Army, Navy, and Air Force in different numbers, and we're required to provide military personnel to accomplish that mission. We are doing impacts. We are looking at the impact and mission in terms of patient care, in terms of teaching, in terms of in and out patient services and ancillary services. But at the end of the day, as a military health system, we are charged with a national response. We'll do that, and we'll try to keep you informed as to what that impact is going to be as we go forward.
Thank you. On a related question about staffing, will BAMC start increasing the number of military medical personnel to address shortages?
I'll take that one, sir. The hospital is staffed to the maximum allowable levels authorized by appropriate manning guidance. In the event there are shortfalls to certain areas, we request a mission essential requirement, or MER, to obtain backfills for projected losses and actively engage our higher headquarters to fill mission essential positions. We rely on data from Demmer's Eye and are counting on our staff to properly reflect their time and task each pay period, who we can properly account for and fill any shortfalls.
Thank you.
I'll add to that. So it was, as far as manning, Command Sergeant Major said it, there is always a tension in the military health system with what the analysis at DoD level will provide us in terms of uniform providers, techs, medics, and so forth, versus what the Defense Health Program will pay for, which is what we can afford, and then what the network can support. And again, it's not just a BAMC issue. The resources that are required here are required at every post-camp and station. And so while it's not, we don't make those decisions, we make recommendations, and the Army supplies the Army billets, the Air Force supplies the Air Force billets, and then we're given a budget or a pay cap as to what we can hire in terms of civilians and contracts. And so every day, on a daily basis, in fact, we just came from a meeting about an hour ago where we look at what is it that we can afford, and then balance that with the mission that we're charged to do. And again, we are charged with coming up with, here's the risk, here are the mitigation strategies, and being able to try and balance all that is a day-to-day job, but it's something that we take very seriously. So thank you.
Many of our MAP providers and technicians were notified they're being pulled out in the spring for a field exercise. Will we need to reduce hospital capacity during that time?
So I'll take this one. As I said before, it's our mission to maintain a ready medical force and a medically ready force to support DoD requirements around the world, not just at BAMC. And training, like it or not, is essential to this effort. I know it's disruptive. I know it takes away from patient care, but it's why we exist in uniform. With that said, to ensure safe, high-quality health care at all times, we continuously monitor our available staffing and adjust our capacity as needed, and we report this up through DHA and service lanes. So please know that your voice matters in this effort. We depend on you, the frontline team members, to let us know if there's an impact to the mission that we don't see, because it's our job to articulate risk and have decision makers make decisions.
I'll add a little bit to it. We encourage everyone to use their chain of command for suggestions or concerns. Another avenue, our new Ask the Commanding General and Command Sergeant Major a question program. Look for the icon on the BAMC SharePoint homepage. You can submit questions anonymously or provide contact information, and we will provide an answer directly back to you. If beneficial to the entire organization, we will feature the information in the weekly command message or at a town hall like this one.
Thank you. Moving over, we got a few Facebook questions. We're going to deviate for a second. Does one vaccine have more side effects than the other, such as Pfizer or Moderna?
So far, not really. Those two are pretty equivalent in terms of efficacy and in terms of side effects.
Thank you. The next question is, when can dependents get the vaccine?
Good question. So the dependents, it's important for everybody to keep track of where we are in the vaccination schema. And right now, if you follow that, we're going to put a link to it in this comment section to the DoD schema. So right now, we are vaccinating in the 1 Bravo category, and the dependents, or I should say retirees that are in that category, would be the 75 and older. We will be able to move into the younger dependents with health conditions and those that are 65 and older when we get to the 1 Charlie, and that will be when we get more vaccine. So as of this time, it's always changing from day to day and week to week, but my estimate is I don't think that we're going to get into that phase possibly for weeks. It could be a couple of months. It just depends, and we will keep you all updated on that status as we get vaccine.
Yeah, I'll add to that. And so I think when people ask the question of when, it's not time-based, it's conditions-based, really based on how much vaccine that we acquire and can use to get through the folks who are in the higher level tiers working our way down. And that's not something that we necessarily have control over. It is that way throughout the country. And so the Department of Defense gets allocations of vaccine along with states and territories and so forth. The DoD gets that allocation. The Joint Staff then decides how much the Army, the Navy, the Air Force get. That Army allocation is then subdivided at Army headquarters, and hospitals like BAMC get their allocation, but it's not as if we can order it. It is pushed to us. And that push is not necessarily something that we have visibility over. We receive it, and then we use it as quickly as we can for the beneficiaries that we identify per tier. So in terms of timing, we cannot give you an exact time as to when beneficiaries will be able to get the vaccine, because it's simply based on how much vaccine we get per week.
I could just add on to that also. A related question that we get a lot is with regard to, out in the community, it's still pretty hard to get vaccine. But in the city of San Antonio, for example, you can possibly get a vaccine appointment for 65 and over, or for under 65 with a medical condition. And the tiers are a little different. So the CG already kind of unpacked that the DoD has its own tiers that are a little different from the CDC, and that's also different from what Texas is doing. So just because you're not eligible yet to get a vaccine in our system, in the DoD's system, does not mean that you may not be eligible to get a vaccine in the community should you be able to get an appointment. And no one, TRICARE, the DHA, no one is holding you back from doing so if you meet Texas criteria and are able to get an appointment in the network. You won't be charged for that. Again, access is similarly limited because we all have the same supply chain issues, but that was one nuance that I thought was important to tease out.
Yeah, that's a great point.
Thank you very much. And we'll post a few links later on to some of the city websites where people can look up that information.
Yeah.
Next question is pre-submitted. Will there be any changes to quarantine or testing requirements for people who have been vaccinated?
So I'll take this one. And this is a very timely question and really a moving target. So just for everyone's visibility, just yesterday, the CDC issued updated guidance about what to do with regard to quarantine in immunized individuals. And in a pretty significant change, the CDC has recommended that individuals who have been fully vaccinated, meaning they're at least 2 weeks out from their second dose of vaccine, they're within a 3-month window of having that second dose, and as long as they remain asymptomatic, should not have to quarantine. Now, that's the CDC's guidance. We follow the DoD's guidance and the DHA's guidance, and so far we haven't gotten updated guidance on that. So for us, if you work on JBSA, if you're a BAMC staff member, if you're active duty and you have an exposure to COVID-19, even if you've already been vaccinated, as of today, February 11th, right now at noon, we're still doing the same things. But you may start to see changes out in the community, and if we have beneficiaries who have received 2 doses that don't work on JBSA, according to CDC guidance, they may not any longer have to quarantine so long as they fall within that window. Testing requirements really haven't changed at all. So again, this is a moving target. It's something that we'll continue to push out updated guidance on as soon as we get it, really from higher headquarters. But again, this is one of those nuanced areas where the CDC guidance and the DoD guidance may not always be completely convergent, and we'll be following the DoD guidance while that remains in effect.
We did get several Facebook questions, so I'm going to shift over to that for a few minutes. How are pre-existing conditions verified before the vaccine is given?
I'll take that. Another good question. So currently between Wolford Hall and BAMC, we are working on that process at this time to identify that and provide you that visibility on verification. We do have the ability within our enrolled population to pull diagnoses and comorbidities that you have in order to identify you and make that determination.
Right, and just to add on, because we haven't gotten to any kind of risk category that stratifies you by medical condition, that'll be something that we make sure is socialized when we get to that phase of the operation, just so you know what to expect.
Next Facebook question, will children get the vaccine as well?
So right now, the Pfizer vaccine EUA is for anyone ages 16 and older. And so when those beneficiaries or individuals who have a pre-existing medical condition come into that phase of the operations, the 16 years and older ones we do have a vaccine for. Trials currently are ongoing with adolescents. Actually, I think the Pfizer trials have finished enrollment. There's other trials involving Moderna vaccine to look at older adolescents, ages 12 and up. So the expectation is that, sometime this year we will have an EUA product for adolescents. And when those trials are done, then trials will be completed in younger children populations. So ultimately, we expect that there will be vaccine candidates available for children, but there aren't any that are currently approved.
Can you speak to why some people experience severe side effects while others do not?
Short answer to that question is we don't know. We do know that a significant number of people who receive, we're using the Pfizer vaccine, but the same goes for Moderna, that a significant number of patients have side effects, usually self-limited, maybe a fever, aches, headache, that sort of thing. In patients who had side effects and who didn't have side effects, the vaccine appeared to be equally effective. But we don't know why some people are more susceptible. We do know that the older you are, you tend to have less side effects. And that is the same with other vaccines as well.
Okay, moving away from Facebook for just a moment. And this question is somewhat similar to one we answered, but I think it definitely bears repeating because it's important. When will we begin our next phase, such as for beneficiaries ages 65 and older?
Hot question of the day. As has been said, we don't have visibility on when we will have abundant vaccination available for our 65 and older throughout our health system. We are dependent upon the supply chain, and we are administering within that schema that we've been talking about. We have a limited supply of vaccine, and we have a large beneficiary population. So when we looked at the numbers in our catchment area, the number of eligible beneficiaries over 75 is over 25,000. So that's kind of where we're at with getting small amounts of vaccine with a large amount of people at this time. So right now, if you're 75 and older, when we have vaccine, which is not at this moment, but keep on the social media channels that we're posting and talking about today. But when we have the vaccine, you can call CAMO to book your appointment, and we've been doing that at Wolford Hall. Appointments are currently filled, but we are hoping to open more soon, just as soon as we get more vaccine. If you're enrolled at the Audie Murphy VA, you can arrange to get your vaccination at the VA. If you are Tier 1A or 1B, you can also, as Dr. Yoon said, you can try city vaccination sites or check with your local retail pharmacy for availability as they get vaccine. Keep in mind the vaccine is free, so you can, if you're able to get it elsewhere earlier than we have it, that's okay. As we expand to the tiers, you will see announcements on the JBSA website and on the BAMC Wolford Hall social media site.
Thank you very much. Great information. Are children required to wear a mask in the hospital?
I'll take this one. So as a rule, all staff, patients, and visitors ages 2 and up are required to wear a face covering while in a military hospital. Additionally, recently the Secretary of Defense directed that all individuals in indoor and outdoor shared spaces on any military installation wear face coverings in accordance with the most current CDC guidelines. This includes wearing a mask in any location on a military installation other than someone's home. And I think these are really important to help stop this pandemic in the face of, getting these vaccinations done and hopefully getting to community immunity.
Thank you. When is it recommended to receive the second dose of the COVID vaccine if an individual has tested positive after receiving the first dose?
So as soon as possible, as soon as really it fits within the schedule. However, the only thing we don't recommend really is breaking isolation to get the second dose of vaccine. So if you're currently sick with COVID and you're due for your second dose, go ahead and finish out that isolation period and then come in for your second dose. Similarly with quarantine, if you've been in close contact with somebody with COVID and you're in your 14-day quarantine period, just come and get the second dose when it's time for that after you finish your quarantine.
If and when we need to get a booster shot, do we need to get the same vaccine we got initially, or can the booster be from a different manufacturer?
So at this time, once you finish your 2-dose series of we're doing Pfizer vaccine, the same as with Moderna, then there is not currently any recommendation for a booster shot. And so we're waiting on that information, more to come. And then when that does occur, we also wouldn't know whether it would have to be the same vaccine or whether it could be a different vaccine. So this is ongoing information and research, and there'll be more to come.
Going back to Facebook questions, if you get the vaccine, is a new one needed for the additional strands identified from the UK and South Africa?
So far, no. So far, the two vaccines that we have are the vaccines that we have EUAs for. It's possible that at some point in the future there will be a strain that's identified that one of the approved vaccines doesn't end up covering, and there will be kind of a re-engineered vaccine in order to cover those strains. So again, February 11th, no, there's not a different vaccine to get, and there's no need to get a different vaccine.
This next question is very much tied to that. It also speaks to the variants. Multiple variants of the virus that cause COVID-19 are circulating globally. Do we expect another spike in COVID-positive patients? Does that play a factor in keeping us at health protection condition Charlie, or HP Con Charlie?
I'll take that. So certainly everyone worldwide really is watching the emergence and spread of these various strains around the world, some of which may have differences in transmission risk or risk of disease. But the health protection condition level is determined by the installation commander in coordination with public health and really based on current epidemiology. I think everyone expects that we may continue to see waves of COVID with or without widespread transmission of these new strains until we achieve public immunity through immunization of the population.
Thank you. As a dialysis patient, will the process of being dialyzed affect the potency of the vaccine? Will the 95% effectiveness of the Pfizer vaccine be compromised?
Good question. I think the answer to this question may also apply to many of you with any type of condition that might suppress your immune system. So dialysis patients may have a decreased immune response. That being said, there were no significant differences in efficacy amongst different groups of people in the trial for the Pfizer vaccine with different health conditions. The vaccine was still effective even in patients with advanced stage or other significant medical conditions. We don't expect the process of dialysis itself would be expected to have any effectiveness on the vaccine. And in fact, patients who are on dialysis are encouraged to stay up to date with all their vaccinations. And we encourage you to get the COVID vaccine.
What, if any, are the long-term effects of having COVID-19?
So some people really will have no long-term effects. Obviously, some people don't have symptoms at all after having COVID-19. And while most people with COVID-19 will recover and return to their normal health, some people will have symptoms that last for weeks or even months after recovery from acute illness, and not always the ones with the most severe illness. The most common symptoms after recovery can be long-term fatigue, shortness of breath, decreased exercise tolerance, or muscle aches and pains. And still others, and importantly, not just those, again, that were hospitalized with severe disease, can notice a lack of energy or brain fog, which can last really for months. Also, sense of smell has been something that has taken a long time to return in some patients. And researchers are currently working to identify really how common these various issues are of these long-haul COVID symptoms, as they're called, who's most likely to get them, and whether and when these symptoms eventually resolve.
Thank you very much. Moving over to the Facebook questions, someone asked, do we really need to get the vaccine? So, or maybe we could put it as, why is it important to get the vaccine?
Mm-hmm.
So I can take that first. You know, these vaccines, a lot of people have asked, why is it important? You know, can I take my chances with COVID-19? And what we've seen so far is really the scorecard of your chances with COVID-19 versus the scorecard of your chances with the vaccine. There's really no comparison at all. So something like 30 million diagnosed cases of COVID-19 just in the United States, and almost 500,000 deaths, not to mention all the ICU admissions and hospitalizations and brain fog problems for months and all these other things that we were just talking about, versus many tens of millions, almost 100 million doses now given around the world of the COVID vaccine and 0 deaths associated with that. So, while it's true that you may get COVID-19 and be fine, you're almost guaranteed to be fine after getting the COVID vaccine because we really haven't seen significant side effects from that. And then the other thing really is risk of transmission. So, we don't know quite what the impact is of vaccine on risk of transmission, but those data are starting to accumulate. And really with every vaccine that we give that prevents disease, like we know the COVID vaccines that are currently available have about a 95% reduction in likelihood of illness. With any vaccine that prevents disease, we also usually see a big decrease in transmission risk. So I think we can expect to see that these vaccines are really our key to reducing that risk that we can present to the population, even if we ourselves don't get sick. So all of us really in the infectious disease and kind of the immunology community are looking, like all of us are, for what is the end of this pandemic going to be? How do we get through to the other side of this? And this public immunity or community immunity, whatever you want to call it, we probably need to get about 80% of the population immune to COVID before we can sort of be done with this. So we can get there the hard way by infecting everyone with COVID-19 and dealing with overwhelmed hospital systems and funeral trucks and makeshift morgues and all of that, or we can get there the relatively easy way by vaccinating people. So to me, there's a sense of urgency about just mitigating the harm to humanity and all these excess deaths that we've been seeing through the last year, and the way to do that is through immunization.
Thank you so much. Will you allow contractors who work in Army programs to get vaccinated at a military hospital?
I can address the contractor question. The contractor question is challenging. The Deputy Secretary of Defense put out a memo in December, and in that memo it specified that contractors who, so first of all, there's contractors who work at a healthcare facility, and those contractors are definitely covered. The next question would be contractors who work for, so in the 1 Bravo category, contractors who work for a critical national capability. And in that case, the language is that the contractor can get the vaccine if they get their occupational health through the military treatment facility, or if there's language in the contract that allows some healthcare and vaccination to occur through the military treatment facility. So now that being said, when your contract was written, obviously COVID probably wasn't going on. So that's where some of the ambiguity lies. But in general, it's really if you're a contractor working for healthcare or a critical national capability, which your unit will know that and be able to tell you if you're in that category, and then you have to look at the contract.
Thank you. Can a person be reinfected if they've been previously infected?
And the answer is yes. Just like getting a seasonal coronavirus infection, which we may not have all thought about it prior to this, but which is one of the causes of the common cold, you can be reinfected, and we don't yet know how long natural immunity lasts from COVID. We do know that in some people who get the infection, that their immunity may last for maybe 90 days. The reinfection can range from getting just asymptomatic, being an asymptomatic carrier, to having severe disease. We can't predict if you're going to have a milder or a more severe course. In addition, as we've already started to discuss, some of the new viral strains may also be more likely to cause reinfection. However, we don't have the data yet to see that rate. But I think this all gets to the point of we collectively, not just the DoD, but the U.S., would like to vaccinate you as quickly as possible to mitigate the risk of reinfection, whether it be with the current strain or the the new strains.
What is the recommendation for pregnant and nursing women?
Great question. So pregnant women and nursing women weren't specifically included in the trials, although a number of women became pregnant actually over the course of these studies. But pregnancy itself is not a contraindication of the vaccine. And pregnancy is also a condition that increases risk of complications from COVID-19. So getting COVID during pregnancy is quite dangerous. The risk of ending up hospitalized on a ventilator in the intensive care unit is about 4 times higher for pregnant women, and the risk of death is twice as high. Pregnant women also have other clotting complications and things like that, which are bad for both mom and baby when they get COVID. So the American College of Obstetrics and Gynecology is recommending that COVID-19 vaccines should not be withheld from pregnant individuals. And they also recommended that vaccines should be offered to to breastfeeding individuals, similar to non-lactating individuals, when they would otherwise meet criteria based on their prioritization groups.
Thank you. Next question is one I've wondered myself. Is there any relation to vaccine side effects and effectiveness? That is, if you have more vaccine side effects, do you have greater antibody production?
We touched on this a little bit earlier, and there is no evidence that having more side effects means that you're more protected. This may be a relief to those of you with no side effects, and perhaps a little bit of an insult to those who had severe side effects after the first dose and perhaps needed to miss a day of work. Everybody's immune system reacts in a slightly different way to the vaccines, but it is good to know that we are protecting more than just those of you who had side effects after the shots. As far as the side effects, in general, they are relatively mild. You know, a headache, maybe a fever, maybe feeling some body aches for a day or so. Don't expect to do something, you know, huge or on the day after your vaccine so that you're not miserable. But we can't predict which of you are going to have those side effects, but we can predict that almost all of you that get the vaccine will be.
Another question from Facebook, is the shot safe for those with aneurysms?
Yeah, so I can take that one. So, you know, aneurysms I don't think are a specific comorbidity that increases risk for COVID. But there hasn't been any kind of safety signal that they wouldn't be safe for people with COVID, and really no biological reason that I can think of that a COVID vaccine would be a particular problem for people with aneurysms.
Thank you. This one ties into the face covering question from earlier. What do you recommend for staff who work in cubicles less than 6 feet apart?
Right, so you know, we really followed the DoD guidance on this, which, as the CG mentioned, was just updated earlier this week. But really everyone is to be wearing a face covering at pretty much all times while on the military installation. And it's, you know, whether you're within 6 feet of someone else, whether you're not, whether you're in a private office, you know, the only really exceptions were briefly to take off your mask to eat or drink something, or, you know, like we're doing now for just articulation, or if you're in the office with the door completely closed and floor-to-ceiling walls. So what masks are we encouraging? Obviously, if you're doing patient care, then we're using personal protective equipment that is relevant to that patient care experience, whether it's a surgical mask or an N95 mask as appropriate. And for just, you know, administrative work that isn't face-to-face contact with the patient, then your cloth face coverings that are otherwise authorized on the military installation are good. And again, we don't use the ones with exhalation valves.
And for more information, there actually is a BAMC policy on PPE that is very specific to roles and locations and mostly revolving around patient care, but also administrative areas. So if you have not seen it or you're not aware of it, please get with your supervisor, because it's something that everyone needs to know to keep ourselves safe.
One more from Facebook. Can personnel who received their first dose elsewhere receive their second dose at BAMC, or we can add Wilford Hall?
Take that. So both at Wilford Hall and at BAMC, we have the Pfizer vaccine. So first of all, it depends on which vaccine that you had. And currently, the quandary with that kind of depends upon where what your status is. So if you, for example, we've been talking a lot about tiers and categories, and so if you got your vaccine and you are younger than 65, we may not be able to give you your second vaccine. Most sites actually want you to go to the site that you got your first shot. Now, that being said, we do have people that PCS in, or we have people that are deploying and maybe they're coming here for training. And so in those instances, either Wilford Hall or BAMC should be able to work you in to get your second dose. So if you're an active duty member, work with your supervisor and your unit to get that scheduled. And if you're either way, you would be going through your unit to get that scheduled.
Thank you. Another Facebook question, and this one's kind of tied to that. Are non-beneficiary DoD civilians authorized to have the vaccine administered at BAMC or Wilford Hall?
So to kind of add on to the contractor discussion that we had earlier, so the DoD guidelines tell us that if you are a government civilian but not a TRICARE beneficiary, you can get the vaccine if you work in the military treatment facility. So part of that first phase. You can get the vaccine if you work in a unit that is a critical national capability. So again, work with your unit to have that determination done if you are part of that critical national capability group, and then yes, you can get the vaccine.
Thank you. Moving back to the pre-submitted questions. This one's about quarantine, another one about quarantine. If I'm exposed to COVID-19 but had the vaccine, do I need to quarantine?
Yes, so, and we talked about this earlier, it's a little bit of a moving target because the CDC just updated their guidance on this yesterday. But for now, nothing has changed on the installation, nothing has changed within BAMC with regard to the need to quarantine after vaccine. We're looking forward to, updated guidance, and we'll certainly push that out when we get it.
Next question. When can we stop wearing masks?
I think we all have that same question. So we hope soon, but that's a qualified soon. There are several milestones that we have to meet as a nation, as a global community before we stop wearing masks altogether. The first would be that we're having minimal viral activity and spread. The second would be how many of us are vaccinated or immune to the virus. And then the third will be potentially better understanding of what happens after we get vaccinated. Is there any chance that the illness can still be, the virus can still be transmitted? So the White House Task Force projects that by the end of summer, the goal is to meet a relative return to normalcy. That might include no masks. It might include masks in certain situations. All of that is guidance to come, and we'll see depending upon how quickly we can get through this vaccination campaign.
Thank you. Why should I get the vaccine if I might still be able to pass COVID-19 to other people?
Yeah, so that's an excellent question, and we addressed some of this earlier, but COVID-19 infection is serious business with some real long-term consequences. So the risk of a bad outcome with the COVID-19 infection itself, like I mentioned before, is so much greater than the risk of a bad outcome with COVID-19 vaccination. So far there have been 28 million or so known COVID cases in the United States with, again, almost 500,000 deaths, 480,000 deaths this week. In contrast, there actually have been over 138 million doses of COVID vaccine given worldwide with 0 deaths related to the vaccine. For myself, I don't want COVID-19. I don't want to feel sick. I don't want to miss my workouts. I don't want a chance getting severely ill. I don't want to have time for COVID brain fog. I don't need that in my life. I don't want to miss 10 days or more of work, at least not because I'm sick. And I don't want to spread it to my friends, my family, my patients. I don't want to end up in the ICU or worse. And again, passing COVID-19 to other people after vaccination, like I said before, is not a certainty. I think this is something that's getting lost in some of the media messaging about this. So most vaccines decrease transmission as well as symptomatic infection, and this is unlikely to be an exception to that. There is actually data, some early data from one of the vaccine manufacturers, that the risk reduction in transmission, which really they've extrapolated from how much virus people had in their nasal cavities after asymptomatic infections, is about a 2/3 reduction. And so we expect decreases in risk and transmission after the COVID-19 vaccination. We just can't totally quantify them for you yet to the point that we're all removing our masks and going about our business with our daily lives.
Next question. Will vaccination cause a false positive COVID-19 test?
No, the vaccine will not cause a false positive COVID test. When you get the swab, it's looking for genetic material that is not given to you from the vaccine. The vaccine is just going to cause your body to briefly make the spike protein to which you'll make the immune response, but it will not cause a false positive test. We sometimes get asked this from people who are having pre-procedural testing or other types of testing, that they get worried that they're going to have a positive test. And through the swab tests, you will not have a false positive test.
Thank you. Going back to Facebook, this is the first time I've seen this type of question. Will the vaccine create problems for those who are allergic to the flu shot?
Yes, so actually there's no real cross-reactivity between flu shot allergies and COVID vaccine allergies. The only people that we know shouldn't get a COVID vaccine related to allergies are people who have a specific allergy to those vaccines or to the components of those vaccines. So there's PEG and then polysorbate are the two kind of antigens that are identified as potentially provoking allergic responses in the COVID-19 vaccines, but those are not the same things that provoke immune responses like allergies and anaphylaxis to the flu shots. Likewise, egg allergies, kind of similar question, not an issue with the COVID vaccines.
And speaking of the flu shot, can the COVID-19 vaccine and other vaccines, such as the flu shot, be given in a close time frame?
Right, so right now the recommendation is to administer the COVID vaccine series alone with a minimum interval of 14 days before or after administration of any other vaccine. So whether it's flu, shingles, etc., you want to get those doses in 14 days before you start the COVID vaccine, or wait and start the whole thing 14 days after you're done with the COVID vaccine series.
Thank you. Will people with serious illnesses be prioritized ahead of healthy 65-year-old patients?
Good question. Another phase question. The phase, the 1C phase that we'll be moving into after the current phase will include beneficiaries who are over age 65, and it will also include those younger than 65 who have pre-existing medical conditions. They are part of the same phase, and when you get vaccinated, when you're part of those two groups, will depend on how much vaccine we get and when we get it.
Moving back to Facebook, what is the longest time you can wait between the first and second dose and still have the vaccine be effective?
The current guidelines are that you can actually go, there's no minimum, there's no maximum, I should say. So originally during the study of the Pfizer vaccine, they went out up to 42 days. We like to have it, at 3 weeks or as close to that 3 weeks as possible. But if it happens to be over 42 days, for example, you travel or get ill or something happens, you can get it later, and we still believe that it will work for you.
And I think the key there, and what gets asked often, is if it's beyond 3 weeks, do I have to restart the series? And the answer is no. They do not need to restart the series.
That's right.
Thank you. Next question. What is the definition being used for frontline essential worker?
So as we've been talking about, we use the DoD's phased plan, which outlines the individuals in each phase. And we are going to include a link to that so that you can look at that yourself. The DoD's note that the schema and specifically also the section on essential workers might differ from the state of Texas or other states. As background, based on the CDC's guidance for prioritization, the DoD developed its own population schema to prioritize our vaccination efforts, as we are one of 65 different jurisdictions that get vaccine. It's important to note that the DoD has unique considerations for our population, including some critical national capabilities and deployers, so you may notice some differences in how our schema looks and, for example, how Texas looks. And this will vary in terms of who's prioritized the different populations and the targeted distribution of our vaccine.
Thank you. And kind of tied to that is the next question. How will TRICARE beneficiaries who teach and work at Fort Sam Houston ISD, to include teachers, aides, food preparers, and custodians, get COVID vaccines?
I think this is a great question, and it is one that between Fort Sam and Wolford and Lackland, we have had discussions about this within the DoD schema. So at this time, and keep in mind that changes can occur, for the DoD frontline essential workers that are educators, the DoD vaccine is for those educational activities that include the Department of Defense schools or the DOD schools, the DODEA schools, the Department of Defense in Europe. Those are what's included in that. At this time, it's a little bit of an eligibility question. So those here at Lackland, at Fort Sam, at Randolph, the employees of those schools do not, although you work on the base, you're not working specifically for the DoD. And so the DoD is not currently at this time, earmarking that vaccine for you. You may be eligible through the state system, and you may be eligible as a TRICARE. If you're a TRICARE beneficiary, you'll be eligible in your current phase based on your age and any diseases that you may have. This is definitely a question that we want to protect as many people as we can, but we're working within the limits of the DoD schema that we have.
And next question, and perhaps the final, unless we get another one from Facebook, are the embedded GS military and family life counselors and social workers getting vaccines?
Great. So if these individuals work in a military treatment facility, one of our clinics or hospital, they are considered phase 1 alpha and as such are eligible.
Wonderful. Thank you. That concludes all of our questions. We really appreciate everybody who submitted questions in advance and greatly appreciate all the interaction from Facebook viewers. That was great, very helpful. Thank you. And thank you to our panel members for taking the time to provide valuable information about the COVID vaccine. Sir, Command Sergeant Major, any closing remarks?
So first off, these were outstanding questions, both the ones that were submitted in on Facebook. So thank you very much to our distinguished panel members. We really appreciate the knowledge and the science you bring to the discussion. And we all hope that this town hall helped address most of your questions regarding the COVID-19 vaccine. Know that we will continue to provide updates during monthly virtual town halls, as well as the BAMC website and social media platforms.
Please keep in mind that some of the information we've shared today may change in the future as we gain new information and guidance is updated. We encourage you to continue to reach out to your chain of command, these experts, or your command team if you have additional questions or concerns.
Yeah. And as always, remember the 3 W's. Wear a face covering or mask, watch your distance, and wash your hands or sanitize regularly, both on and off duty. So on behalf of the entire command team, we really appreciate every member of this team. We know that the past months, the past year, have been really stressful, and I want to thank you for continuing to provide safe, quality care to our patients, and thank you for your continued professionalism and dedication. Take care of yourselves, your families, and each other. Stay safe. One team, one purpose.